Okay, I'm sorry, just making sure we have this recorded. Okay. Okay, I'm sorry about that. So this webinar is specifically tailored for childcare facilities. Today, we're going to learn from an expert who will share valuable knowledge and strategies to help us understand and mitigate the impacts of radon in our childcare environments. So let's get ready to dive into a session full of essential information and actionable advice. But first, let me provide you with some background information about Women for a Healthy Environment. So our vision is a world where everyone has access to a healthy environment. And so just so you know, this is our mission, but we is a nonprofit organization that empowers underserved communities to build resilience, promote equity, and safeguard children from environmental health risks. We collaborate with families, schools, and early learning centers to create healthy environments where children can flourish. We're guided by science, and we advocate for policies and programs that foster equitable lives free from environmental harms. And childcare providers like yourselves are drivers of change in keeping children's health and healthy and safe from environmental toxins in their learning environment. So we have 3 different program areas: schools, homes, and early learning, and we're in Pittsburgh and Philadelphia. We have the Healthy Childcare Champion Program, where you can become Children Environmental Health Network Eco Healthy Endorsed. You get a 3-hour credit, 2 points for Keystone Stars, supplies to help you, enrollment in WEES programs, and an in-person assessment. We have our 1,000 hours a year program, which addresses the dangers of lead and radon exposures to children. And we award many grants to childcare facilities for lead and radon and remediation. This is specifically available in Allegheny County and Westmoreland County now. And here's some examples of some work that we've done in childcare facilities. So I'll hand this over to our speaker, but I'm delighted to introduce our speaker, who is going to get deeper into the topic of radon, covering aspects such as testing, mitigation, and specific considerations for childcare facilities in Pennsylvania. Nate Burden is a leading radon scientist that has been in the IAQ and radon field since 1986. He is the current president of the PA chapter of American Association of Radon Scientists and Technologists. He is a graduate of CMU with a major in physics and graduate study in nuclear physics. And he also sits on the PA DEP Radiation Protection Advisory Committee and several other radon standard committees. And he is a senior radon instructor training hundreds of people nationwide on national certification in radon measurements and mitigations. And he has installed and designed over 4,000 radon mitigations, not only for schools, but residential, large buildings, and many other across Pennsylvania. And so without further ado, I will introduce Nate Burden. And I will stop sharing so that you can now present. There you go.
Okay. Yes. Okay, everybody see my screen?
Yes.
Okay, great. Let me just make some adjustments. There we go. All right. My name is Nate Burden, as Pacola just introduced me. I've done radon testing, radon mitigation since 1980. I've been on several different committees working with different schools and different things like that. Done some research with Argonne National Laboratories, besides having gone to Carnegie Mellon University in physics and nuclear engineering. So what we want to do now is talk about child care centers, number one, and about radon and why it's a big deal. A focused training and assessment and recommended action solution presentation. So it's sort of like a training course, but also a webinar just to make you more aware with good, clear, science-based information on why this is something you need to make an initiative and make it part of your standard of care and due diligence. So again, the ideal here is just looking at this call for action is what we're looking to talk about here as I move this here. Great, I can move that out of the way. Okay, so back here to the built environments. Again, our kids go to schools, and then say for kids that are younger than kindergarten, then they go to child care centers. And they go to child care centers. They could be houses. It could be a gigantic child care center like KinderCare or whatever it may be. But again, our kids are spending time in these areas, and these areas potentially can have a very serious indoor air quality risk that is putting the children and the other occupants at risk. So that's what this course is going to go over, why this is important, why child care centers should have radon as one of their key main initiatives. If we were talking about mold or asbestos, this would be something we do that. One, because mold, no one wants to have their children in a place where there's all moldy walls and moldy ceilings, wet carpet, all those conducive conditions for fungal growth. That's bad for kids and their respiratory systems. And some kids are very sensitive to mold spores and different things like that. Asbestos causes asbestosis and mesothelioma. It's a big deal about indoor air quality. A lot of kids have asthma, okay, other respiratory ailments that they may be set with, not only at the child care center, but also at home. So this becomes a big deal about indoor air quality and what we can do about it. And the call for action is the biggest thing you'll hear me say probably 100 times throughout this webinar is that it is preventable. Okay, that's the big deal. Again, the terminology that we hear a lot now is the built environment, a healthy built environment, especially with dealing with indoor air quality. 90% of our lives are spent indoors. Now, this 2 to 5 times more pollution indoors than outdoors. Wow, that sounds sort of like doesn't make any sense, but inside the house, things get trapped. And we bring things in that could produce volatile organic compounds. We could have asbestos, we could have mold. You've got your furnace system, whether it's gas fired or oil fired, okay, which most of them are. There's some electric, but mostly in Pennsylvania, everything is gas fired or oil fired. That means that we're going to be producing combustion gases. We don't want to breathe those in, especially carbon monoxide. And as you get into the wintertime areas, you hear about people and families being rushed to the hospital or dying from carbon monoxide exposure because either the hot water tank has backdrafted or something's not right with the overall HVAC system. So it's a big deal. And the whole point about this is the assessment of good indoor air quality should be a prime directive for all child care facilities, whether large facilities or even home-based. Well, Nate, and we'll talk a little bit about more of this later on. Well, if that's so, that's going to cost money. Where am I going to get the money to make that house healthy? The bottom line is if you're bringing children into a built environment that you're taking care of them for parents and other people, then you really want to be able to prove and show that the environment that the children are living in is a healthy, good quality indoor air quality environment. That is the big deal. PM, particulate matter, dust, vapors, all these things can have a major impact on our children. Small children and infants are more sensitive and their health can be drastically impacted both short term and long term. Children's lungs and their biosystems are in rapid development, okay, including their brains. So I want to do basically a radon 101. Almost everybody's heard about radon, but when you start asking about, well, what's radon? Why should I be concerned about it? And if it's that big of a deal, why aren't more people doing that? So ask some questions. Why is radioactive, toxic radon gas pollutant in our homes, schools, and workplaces and childcare facilities a big deal. I just went through that idea of good indoor air quality. Now, the point here about radon, it's radioactive. It's a radioactive pollutant that comes into our houses. That's a big deal. And it can cause lung cancer and other health risks to us and our children. Is this such a, if this is such a danger to us and our children, why isn't it a priority for everyone? Why isn't this as a checklist that you have a daycare center? That should be one of the number one checklists. Is this building safe, for children coming in here? And could they be exposed to elevated levels of radon gas that could be potentially a carcinogenic that could cause lung cancer and other types of radon related health risks, diseases, or problems? And the next question is, why is radon testing not required for Pennsylvania homes, schools, and workplaces and child care facilities? One, the real reason psychologically, radon is invisible. It doesn't tap any senses. I guarantee you, if radon smelled like 10-day gym socks, that your teenager wore, you would want to do something about it. Or if it came out as a green glowing gas, you would want to do something about it. But because radon is odorless, tasteless, invisible, it's not on our radar. Same thing as carbon monoxide. But the problem with carbon monoxide, that can kill you very quickly. And we know lots of people that have died from carbon monoxide poisoning are going to the hospital because of carbon monoxide poisoning. Radon is invisible and it causes lung cancer. So it should be a big deal. My job is to convince you of that this should be an initiative for your child care facilities, whether they are home based or whether they are large building facilities. So, again, how do I convince you of this? This is always the biggest test, Nate. Here's your job. I've got to convince everyone attending this webinar that radon definitely causes lung cancer. Radon can, be a major health risk to our children. And what are you going to do about it? I'm going to show you the pathway and what can be done to reduce that exposure and make that built environment a healthy environment. So here's a sign I use here just to show you this. How do you communicate a risk? A lot of times we get caught up in the wrong information. If you look at this sign, it says caution. This sign has sharp edges. Do not touch the edges of the sign. That's not really the major message. That's for liability. Whoever put that sign up doesn't want to be sued for someone cutting their hand on it or whatever. But the real message is right down at the bottom that is more important than any of that other stuff. Also, the bridge is out. That you want to know. Therefore, sometimes we get confused, and sometimes it's the small details that count. So, part of my job is convincing you that radon definitely causes lung cancer. So, before we get into that, let's talk about lung cancer itself. So, what is cancer? Basically, this is where all our cells have you have a nucleus and they have a gene, and in the genes are DNA and RNA. And this was a big deal about RNA and DNA back during the pandemic with COVID and everything. That was a big deal. Some of the RNA type vaccines and all that kind of stuff went on. But the key thing with cancer is that when the genes inside the cell, and inside those genes is DNA, if they get damaged somehow, and let's say that gene that controls growth control loses its ability to control the growth of the cell, and it starts multiplying uncontrollably. Now it turns into a tumor. Now it spreads and pushes out other cells, and it can break off and metastasize and say move to another area of the body, like the lymph nodes or the brain or some other place like that. So cancer cells basically are cells that have lost their growth control and can create a tumor and can spread and migrate to other areas of the body. Lung cancer is the number one cancer killer compared to other types of cancer. That's a big deal. Even with colon cancer colon rectal cancer, prostate cancer, breast cancer. Now, a lot of those are increasing also, but the idea that radon or lung cancer is the number one cancer killer is this is something we need to pay attention to. Lung cancer usually is not diagnosed till later stages. So it's going to be rare that you see that the stages is diagnosed as 1A or 1B. It could be usually the diagnosis stage 3 or even maybe stage 2B or something like that, or stage 4. And the other part, the later the stage of diagnosis, the less survivability. Okay, it is estimated for that was 2019, more than 228,000 people will be diagnosed with lung cancer. Smoking obviously is the number one cause of lung cancer. Radon is the second leading cause of lung cancer. And get this, well, Nate, I don't smoke. Okay, but for never smokers, radon-induced lung cancer is the number one cause of lung cancer in never smokers. And you've got to really have respect for that and think about that. I'm trying to give you some basic statistics and science to show you why this is a big deal. Lung cancer accounts for 27% of all the cancer deaths, making it the deadliest cancer. That's the point that we want to be able to deal with. Now, some radon facts. What is radon? It's an odorless, colorless, tasteless, radioactive, that term there. What does radioactive mean? And it emits particles of energy at a high energy that can interact with um, molecules and atoms and electrons and can knock out those electrons. That's called ionizing radiation. So radon is produced by the breakdown of uranium in the soil and rocks. That decays down eventually to radium, and radium decays into radon. Okay, that's radioactive. Pennsylvania, the geology actually has an area called the Redding Prong area that has a high concentration of uranium and radium content, along with thorium, just by the geology. And there are several states besides Pennsylvania. There's North Dakota, South Dakota, and other areas that have very high levels of radon. Although Pennsylvania is known to have some of the highest radon measurements tested that have ever been recorded. And that was in Allentown in Lehigh County. But all across Pennsylvania, there have been elevated radon levels. EPA says about 15% of the homes in the US have unsafe radon levels. Radon, get this, radon carries approximately 1,000 times the risk of death as any other EPA carcinogen. Asbestos and some of the other ones, there's a couple of other ones that are looked at as Class A carcinogens. Radon is a cancer-causing gas because it's radioactive. Radon, like carbon monoxide, is tasteless, colorless, and odorless. It doesn't activate the senses. So it's not something that if you smell a gas that smells like rotten eggs, like methane or something like that, you're going to react to that. I want that out of there. Okay, but because it doesn't, activate any of your senses, it sort of gets in the background. You don't see that. Radon breaks down into radioactive particles. The radon gas itself is not really the major health risk. It's the radon decay products that decay from the radon that we breathe in that now get trapped inside our lungs and bombard our basal lung cells with ionizing alpha radiation. We'll talk more about that as we go through. So radon is the leading cause of lung cancer, I guess, for non-smokers, and is the second leading cause of lung cancer for everybody else. Okay. Now, this is right out of the Pennsylvania Department of Environmental Protection. This is something that you can do is Google, just say, the Pennsylvania DEP or Pennsylvania Department of Environmental Protection, radon. It'll take you to the radon section of that. We actually have a radon department run by Bob Lewis, Denise Blyler, Ryan Fox, and a couple other people there. And they're in charge of radon in the United States, in Pennsylvania, with the goal, their ultimate goal is to protect Pennsylvanian citizens against this risk of causing lung cancer, where we want everyone in the state of Pennsylvania to do testing. Probably less than I say less than 10% have tested for radon in Pennsylvania, even though this is the second leading cause of lung cancer. Doesn't make any sense. Now, you look at the second one, 5 things you should know about radon. This is from the Pennsylvania Department of Environmental Protection. It's the number one cause of lung cancer in non-smokers. Okay. It's found everywhere in Pennsylvania. Testing is the only way. I would probably underline that. Testing is the only way to know if your home, school, or daycare center is at risk. Testing is easy and inexpensive. And 40% of Pennsylvania homes have radon levels above the recommended EPA action level, more so than safe level, because really there's no such thing as a safe level of radon. Right, on we go. Now, this just gives you some more information. The EPA action level set by the Environmental Protection Agency is 4 picocuries per liter. The World Health Organization has a different radon action level based on epidemiology studies, a whole bunch of different meta studies on the effects of radon. This is called BEER6, biological effects of ionizing radiation. Is actually a document that's produced to show the actual risk and a lot of data supporting that radon causes lung cancer and potentially other types of health-related diseases. So theirs is at 2.7 picocuries per liter. There is a movement that EPA and other people are considering that they may drop that down to a lower one. And even in the documents, EPA has the Home Buyers and Sellers Guide for radon and the Citizens Guide for radon. And in those two documents, it says that the mitigator, the radon mitigator, should be able to get the levels down to 2 picocuries per liter or lower. Okay, so that's something to remember. Now, just to give you a general idea, the amount of radiation in 4 picocuries per liter of radon is equivalent to that in 100 chest x-rays. Most hospitals only allow people to have 4 chest x-rays or less, okay? And there's different ways to measure that type of radiation. Now, Pennsylvania, you're looking at a EPA-generated EPA zone map, and what the colors show is that the red areas show the highest potential of having elevated radon levels at 4 picocuries per liter or higher. The orange levels show a medium potential of having elevated levels of 4 picocuries per liter or higher. And the yellow area, Philadelphia County, has a very low potential. But we found out in doing testing in Philadelphia, we've measured radon levels significantly over 4 picocuries per liter. So the message here is the only way that you're going to know what the radon levels are is to test your home. And every single county in the state of Pennsylvania has tested with elevated levels above 4 picocuries per liter, some of them significantly much higher. So we want to keep this in mind that Pennsylvania is a high radon state. That's the point that I want you to understand. And as I measured over here, I think we measured in Lehigh Valley in a residential home, the action level was 4 picocuries per liter. We measured over 17,000 picocuries per liter in a home in Lehigh County in Allentown area. Now, this is a Pennsylvania report card. Just to give you more information, this is easily accessible. All you do is just put in ours or say Pennsylvania radon report card, and there's a report card for every single state. Okay, there's one for New Jersey, one for Delaware, one for California, all the way across. But for Pennsylvania specifically, this is produced by the American Lung Association, CDC, and the Indoor Environment Association, which is really ours. Okay, so it's doing business as the American Association of Radon Scientists and Technologists, which I'm a member of. Okay, so what we look at this is the population and lung cancer. Lung cancer deaths in Pennsylvania, 6,778. Lung cancer cases right now that are occurring are estimated to be around 10,805, and estimated radon-induced lung cancers is about 3,000 estimated lung cancer cases. These are not deaths. These are estimated lung cancer cases, okay? Just to keep that in mind. So this is sort of like a sort of quick overview, this is what we show to a lot of different politicians, state representatives, and state senators, and getting them to move. We actually have a bill now that we are pushing through, working with Senator Devin Robinson, basically having mandatory radon testing for schools in the state of Pennsylvania. That should be something that absolutely should be done. Other states have that. We definitely should have that. Again, just to show you how important this is, Governor Shapiro in January, which is Radon Action Month set by EPA, did a proclamation by the governor saying that everyone should really test for radon. It's a serious issue that all citizens that in the state of Pennsylvania, say you own a house or you're even in a rental property or a multifamily building or a daycare center or a school, you should test that facility, the place where you spend time at. So that's the big deal about this proclamation, that even the Governor Shapiro is aware of the importance of this and really is stating to all Pennsylvania citizens, this should be a concern. And when it comes to child care centers, absolutely every child care center in the state of Pennsylvania should be tested for radon. Now, just let me give you a little bit more. This is my 101 course on radon. So it's not just about radon as a radioactive gas. I want to give you the overview for Pennsylvania. So you look at Penn Hills Elementary School in Allegheny County. There have been 3,607 tests reported to the Pennsylvania DEP. The highest level reported to DEP is 101.7 picocuries per liter. Remember, the action level is 4. Okay, so that just gives you a general idea that there's elevated radon levels in Allegheny County. Another area, Richland Elementary School. We're looking at the highest reported level was 325.7 picocuries per liter. The average radon result for houses that were tested in the basement, out of the 6,567 tests that were done, the average is 8 picocuries per liter, which is over 2 times higher than the EPA action level of 4.0 picocuries per liter. We look at Wexford, okay, elementary school, Allegheny County again. Highest level measured 229.5 picocuries per liter. We look at just another area. Let's see here. And we'll go to Lehigh Elementary School, Lehigh County. They had a radon level measurement of 382. So it's not saying that every single house in that county has that level, but the average is 17.5. So if you live in Lehigh County, there's a high probability that when you do a radon test, that test will probably be over 4 picocuries per liter, including child care centers. Berks County, the same thing goes there. 5,423 tests have been reported to the state, and the highest reported level was 484.1 picocuries per liter. Keep in mind that the average action level set by EPA is 4 picocuries per liter. And let me state again, even if the level is 3 picocuries per liter, that is not a safe level. That's number one. There's no such thing as a safe radon level. I just want to make sure we point that out for that. And then you have Richboro Elementary School in Bucks County. Highest level measured in Bucks County, 803.2 picocuries per liter, with the average for just general houses from the 3,245 tests that were done, the average is 8.1 picocuries per liter. Obviously, this shows you that the only way to know your radon levels in your child care center is the test. That's the message that I'm getting across, that this needs to be a major initiative for all daycare centers. Hopefully, we'll make sure this gets, again, to media and TV and things like that, just to make sure that people are aware of this, that this is a big deal. Radon testing in child care centers should be a standard of care. Automatically, every single daycare center should be tested. Putting this in perspective, dealing with risks. So even if you had 4 picocuries per liter, EPA and CDC look at this as if you have 4 picocuries per liter, that's like your child smoking 8 cigarettes a day. So you would not want your 6-year-old or your 5-year-old Smoking cigarettes. Obviously, why? Because it's not good for them. Okay, all that. But just putting this in the right risk perspective would say that every single daycare center should be tested for radon. That's my point. If we look at the other risks that are associated with that, again, 17,400 people die from drunk driving. That's a big deal. And we got all kinds of nonprofit organizations. We got funding for that, and we got 8,000 people in in-home falls, 3,900 people die from drowning, 2,800 people in house fires. But look at radon. 21,000 people are estimated to die from radon-induced lung cancer every year, and it is preventable. And if you think about how much does it cost, for someone to have lung cancer, it's estimated to be over $100,000 by the time you look at the different chemotherapy and other radiation therapy and other types of things depending on the stages. If I could cut that in half, I could save over $1 billion in medical costs to the overall medical community. When we explain that to state senators and representatives, I now have their attention. Okay, because now we're reducing the impact and we're saving lives at the same time. Again, we would do anything to protect our children. We don't let our children smoke. So why would we let them breathe radon gas? Again, someone give me an argument on why this is wrong. Okay. Radon is odorless, invisible, radioactive gas. Keep your families, pets can die from radon exposure. And they've noticed an increase of different types of cancer dealing with pets. That's a whole nother thing that I can talk about later. But again, the bottom line, test your homes, test your daycare centers is the major key that we want to go through. So radon exposure, again, it's about the built environment. Okay, it is the big deal. It should be your initiative. And radon is the number one environmental cause of cancer deaths and the number two cause of lung cancer deaths. And it is preventable. That's the key thing I want to point out to you is the fact that with child care centers, we have the opportunity to make sure our child care centers are healthy with good indoor air quality. And there is funding for that, believe it or not. With Pennsylvania, I would say you want to talk to your state representatives and your state senators. And I'll be glad, along with Women for Healthy Environment, to assist you in that. This is so critical that I think it's critical that we bring this to the forefront, which is why we're doing this webinar with Women for Healthy Environment, that this is such a serious issue that can easily be addressed. So radon and smoking. If you smoke and are exposed to radon, your risk factor of getting lung cancer goes up by a factor of 10. Wow, that gets your attention. Okay, therefore, why would you not want to do radon testing? Obviously, you want to stop smoking, and that means that everybody now, generally in daycare facilities, there's no smoking, but there may be in some home-based facilities where someone there on the upstairs is smoking a cigarette. And that smoke can go throughout the whole house depending on where that's being done. So that could be a big deal that you want to look at also. Now, I already covered this. Radon is a class A carcinogen. Again, I'm trying to convince you to show you that this is a serious enough issue that once you get done taking this webinar, you need to make this an initiative. And I will be glad, again, with Women for Healthy Environment to redo this webinar as many times as needed, okay, in order to make sure that people get the message that this needs to be done. This is not fear mongering. This is something that is real, that needs to be addressed. When you look at the amount of people and the amount of cancers and lung cancers that are occurring in the state of Pennsylvania, okay? That's my point. This is a class A carcinogen. There is no doubt that radon causes lung cancer. We have epidemiology studies. We have animal studies. We have actual case control studies where we look at residential properties, all showing and pointing to radon with the ionizing radiation, with alpha radiation, causes lung cancer. Okay. Now, just to break this down, this is my one-on-one course, for my physics level. So don't get caught up in all the fancy dancy stuff, but just keep in mind that radon gas produces radon decay products. These radon decay products are radioactive. And the radon gas basically, I breathe in the radon, I breathe it back out. Basically, that's what normally happens for almost everybody. But it's the radon decay products that come from the radon, polonium 218, which is an alpha emitter. Okay, so it's a type of alpha radiation or ionizing radiation called alpha emissions, alpha radiation that causes more ionization than the other two types of ionizing radiation, which is beta radiation and gamma radiation. You may know gamma radiation as X-rays, but alpha radiation causes much more ionizations and potentially more damage to the cell than the other two types of ionizing radiation. Well, Nate, you say ionizing radiation. What does that really mean? Well, ionizing radiation means that it's a type of radiation that's emitting particles of energy, okay, say from the nucleus, but these particles can now hit, say, an orbital electron and knock that orbital electron out. That's why we call it ionizing radiation. We're knocking out orbital electrons and changing charges and actually changing the chemistry of the body. And if you keep in mind, a lot of the diseases that occur within the human body are chemical type diseases, diabetes, chemical. Okay. Again, now this is a little bit more, but I want to point out the fact that when the alpha, radon gives off the alpha particles that now hits that DNA, okay, that causes direct damage to the DNA structure, that could be the gene that controls this growth control. That gene now gets damaged and now it loses its growth control. Or I could actually interact with water, and most of our bodies are made up, I think 80% of our bodies are made up of water. The ionizing radiation, alpha radiation, can interact with the water and break up the water molecules that can create what we call free radicals and hydrogen peroxide. All of those are bad for the body. The free radicals are very reactive and will attach to other types of molecules. That can cause problems. Again, as I said, ionizing radiation can cause damage where the cells and the genes get damaged. They lose the growth control. The alpha radiation intersects, hits that DNA helix that you see here, and now that cell has lost its growth control and it starts multiplying, getting bigger and multiplying more. It creates a tumor. That tumor now grows. And now you may not even know this. You could be in the stage 1, stage 2, and there will be no physical signs of that unless you went and got a low dose CT scan that will be have the high enough resolution to be able to detect something like that. So you want to be able to be aware of this, that a lot of times we don't know. A lot of times everybody's born with some cancer cells, but our body has the ability of repairing those cells. But when it can't repair those cells correctly, that cell now mutates. That's called a mutation. And that mutation could be a cell that loses its growth control and starts to grow uncontrollably. And that's a big deal. So the longer the exposure, the higher the risk. The higher the radon level, the higher the risk. If you smoke, the risk of lung cancer is higher. Genetic disposition also plays a part. Some people are more apt to get different types of diseases or things or get sick than other people due to their genetic disposition. And then the last one, latency period. I want to make sure everyone understands this. With radon, you don't get lung cancer in like 1 minute from breathing in radon. It's a latency period of 5 to 25 years is the term that we use. How long does it take to get lung cancer? A lot of that depends on your genetic makeup, how much radon there is, how much you're breathing, but also the latency period is around 5 to 25 years. Starting with kids, then we will want to minimize that by not exposing our children to elevated radon levels. Again, it's ionizing the chemistry. Is the whole point is that I breathe in the radon and the radon decay products. Now the alpha particles from that polonium 218, which is a radon decay product, impacts our cells and causes the damage. Obviously, the more radon you breathe in, the more radon decay products there are, the more alpha particles that are produced. Therefore, the more chance of one of those cells getting damaged, and thus you get cancer, a damaged cell death. If it's a cell death, we don't have to worry, not in the sense of having to worry about that, but it killed the cell and you don't have to worry about that. It's a cell that mutates, is still living, but now it's not working the way that it's supposed to. It loses its growth control, rapid cell mutation, uncontrolled growth creates a tumor or lung cancer or a cancer. And the greatest exposure to ionizing radiation, and I never heard about this, ionizing radiation is our greatest exposure is from radon, that we live in our houses in the built environment. So that's the big deal that I want you to remember. Now, let's bring in a little bit more to this. Besides lung cancer, there are studies that show some correlation that exposure, especially with children, to radon and the radon decay products can cause leukemia or blood cancers, different things like that. This is a case control study of childhood acute lymphoblastic leukemia and residential exposure. And so this study here basically goes through that exposure and looking at a correlation of leukemia occurring within children, okay, from the exposure of residential radon or from your child care center. So this is a big deal. This is another study here. This is the human health impacts of residential radon exposure, updated systematic review and meta-analysis, which means they looked at a whole bunch of studies, but the actual ideal here is that they came up residential radon was revealed to significantly increase the incidence of lung cancer and childhood leukemia, okay, in children. And then you read the last one, the results provided strong evidence that inhaling radon in the indoor environment is closely associated with the development of lung cancer and childhood leukemia in patients living in Europe and areas with high radon levels. Okay, just to give you a general idea of the studies that are being done in the United States and around the world. And again, let me point out, this does not say this is a correlation, which means as opposed to radon causing lung cancer, that's a class A carcinogen. With studies here, it's a correlation that says, hey, we need to pay more attention to this. This is a serious issue. And as they do more studies, they will get to the point where they can say, yep, there's enough evidence to say that's what's happening. Right now, this is a study, so I want to make sure you have it in the right context for studies and correlations. So this is not fake news. This is really real. It's a big deal. And that's the whole point. Because you don't see it is the big deal. And you'll start to see more about this. If you're in Canada, Canada has very strong radon regulations and a whole department that deals with this, where they spend a lot of time on radon in the workplace. That's one of their major features, along with radon and schools and daycares. All right. Patient education. This is right from EPA, the Agency for Toxic Substance and Disease Registry, talks about radon. You can Google this, and it just goes over radon as a radon toxicity. That's so ASTR, ATSDR, that's the Agency for Toxic Substance and Disease Registry, sees radon as being toxic. That's my whole point. So what I'm trying to prove to you that this is something that once you get done with a webinar, oh, well, Nate, that was interesting. On I go with my other stuff. I want you to remember this and come back. I will be available. Women for Healthy Environment will be available to answer any questions you have and to assist you in addressing testing for radon in your child care facilities. Again, this is a big deal. Now, this is right out of that same document. This is the Agency for Toxic Substance and Disease Registry. So I wanted to pull things that are already there. How can radon affect health of children? This is right from there. I pulled it right from the site. A child's different lung shape, size, and breathing rates as compared with adults mean higher estimated radiation doses. Risk of lung cancer in children resulting from exposure to radon may almost be twice as high as the risk to adults exposed to the same amount of radon. Okay. And we started at 6:30. We're still going, no, not bad. We're doing well. I got 14 more minutes to go, or 13 more minutes to go. See, can we get through this? But am I showing you or convincing you that radon is a serious enough issue that you need to make it a prime directive for your child care center? That is the key point that I want to get across. This is not something I'm making up or raising one more thing that we got to worry about. This is serious enough that every child care center in Pennsylvania, really in the United States, should be testing for radon and ensuring that that built environment is safe for the children based on what I just read from the U.S. Department of Health and Human Services Agency for Toxic Substance and Disease Registry. Again, have I convinced you yet of this as being a serious problem? So let me get even a little bit more real. Okay, my other major is cognitive psychology, how people learn stuff. And therefore, here, let's look at this. This is a real picture of a house in Pennsylvania with 100 picocuries per liter. What you are looking at is what we call a cloud chamber. So we use alcohol and dry ice to create a vapor, almost like a vapor there. And inside is 100 picocuries per liter, okay, in this house. And what it's producing is the alpha particles from the radon decay products. Remember, we talked about the alpha particles coming from the decay of radon, and that the main health risk is the radon decay products, polonium-218 and polonium-214. They give off alpha radiation. Those bullet streaks you see are the alpha particles, and that could be your lungs. So if you picture that and breathing in, say, 4 or 10 picocuries per liter or 100 picocuries per liter, this is what's happening inside your lungs. Even though you can't see it, you can't feel it. Those little tracts are interacting with the basal lung cells, and now with the cells causing potential damage to the DNA. Therefore, you can see how lung cancer can be induced for all these bullets. The more radon, the longer you're exposed to it, the more chance you have of getting radon-induced lung cancer. That is my point right there. Now, the other point that I want to get across, normal respiration rates for an adult at rest is about 12 to 20 breaths per minute at rest. Normal respiration rate for a preschooler is 22 to 34 breaths per minute, and even faster when playing and running. Normal respiration rate for school age is 18 to 30 breaths per minute for children, elementary school, high school, and all that. Children are more susceptible to ionizing radiation damage than adults. Children spend 1,000 hours in a preschool built environment. Many schools, child cares, and PA have elevated radon levels. How do you know? When easily the majority of the daycare centers in the state of Pennsylvania have not tested their facilities for radon. So obviously, I've raised up an issue. Well, Nate, fear has two meanings: forget everything and run. I don't want you to do that. I want you to face everything and rise to the challenge. And the challenge and what I call the prime directive is that every single child care facility, whether home based or larger, should test for radon. Okay. Again, as I said before, all the stuff I already talked about, if you could see it, you would do something about it. If you could smell it, you would do something about it. If it was creepy and didn't make you feel, really comfortable, you would do something about it. Again, the analogy is we don't want to be that guy sawing the tree. That's really bad health and safety. Again, the perception of this, you can't see it, you can't smell it, can't taste it or feel it. In many minds of the public and us, radon risk is not truly real. Therefore, why should I address it? Why should I spend money on it? Why should I make this an initiative for all child care facilities? That is my point. Again, this is just something that just happened in October 2022. You may want to remember this. I think it was either 2022 or 2023. Is remember they had a high school, I think it was down in Missouri or someplace like that. and they had radioactive material in the dirt around there from previous radioactive contamination. It was a Missouri school. And this hit the newspaper, hit CNN, had all the different people, and the senators all came out and they're all excited about it. And then the end result, they shut the school down until it was cleaned up. Then they found out it wasn't really that big of a deal. But what about the radon? Isn't radon radioactive in many schools? It is naturally occurring. Shouldn't schools have the same reaction about this radioactive gas contaminant and its decay products as they did here? They shut the school down. This was actually a thing that I printed off there. Environmental report finds radioactive waste in Missouri elementary schools. That was not even close to the potential health risks and radiation exposure that you would be getting from radon. All right. So again, radon is the second leading cause of lung cancer. Radon-induced lung cancer costs the United States $2 billion a year. This is a big deal. Okay. That's my whole point. And again, let me look at this for school districts and preschool. This is an EPA quote from a report that they had. For most schools, school children, staff teachers, and essential personnel, the second largest contributor to their radon exposure is likely to be their school preschool environment. I did not make that up. That's a direct quote from EPA. Therefore, obviously, these are the things you need to pay attention to. So that's one thing that I want to make sure everybody's aware. Now, let's do some more talk about radon. How does it get into a building, Nate? Okay, this invisible gas, it's a radioactive gas that comes from the decay of uranium and radium in the soil. So it's a gas. Gases will go from a greater concentration to a lesser concentration. If you remember all that stuff that you learned in high school, chemistry, and all that kind of stuff there. And radon gases will go from the path of least resistance. If they see something pulling it up, it's going to go that way. So if you've got cracks in your floor, you've got penetrations in your floor, you've got a sump pit or a sump pump, in your floor, you got floor drains, and your basement tends to be at negative pressure, more air is leaving the basement than what's coming in. That's how the radon is pulled into the built environment, normally in the foundation. So, hey, Nate, I don't have a basement. My house is just slab on grade. So I don't have a radon problem. I don't need to test. Not true. Again, if your slab foundation touches the ground, that's an entry point for radon to get in. And a lot of daycare centers may be slab on grade, and you still need to test those facilities. That's number one. Again, just different ways for radon to get in through cracks, through pipe penetrations, below grade walls. If you can see moisture coming through on CMU or concrete blocks and things like that, you can be assured radon is also coming in there. The only way you're going to know if you have an elevated radon level is to test your home, your house, your school, your daycare center for radon. That is the only way you're going to know. And you need to do that test generally in the wintertime, okay? But it can be done in the other season too. But generally, you need to redo that test in the wintertime. The wintertime, the radon levels will tend to be the higher due to the operation of the furnace and thermal stack effect and weather events. Just something to be aware of, okay? Again, I'm just showing different things here. Slab on grade, even if you have slab on grade, you need to test your facility. If it touches the ground, radon can get in. Different ways that radon can get in. These are actually buildings, schools and daycare centers, cracks, control joints, where your conduits and pipelines go into the walls and different things like that, water, sump pits and different things like that. All of these are a big deal. About 6,500 licensed childcare providers were operating in Pennsylvania as of late November 2023. So that's a big deal. So many child care centers are in EPA zone 1 and 2 areas. So all of these, whether it is a house or a larger facility that has a lot of kids in it, you need to test your facilities. That is the point of this. Okay, so both for home base, especially, which Women for Health and the Environment has been spending some time even doing radon testing, in the Philadelphia, Bucks County, Eastern Pennsylvania area for home-based child care centers. The only way to know if the risk exists, I keep saying it over and over again, is to test your daycare center, whether it is a home or whether it is a larger facility. These are just daycare centers in Pennsylvania. Okay. All of these should be tested. With more than 2,162 Pennsylvania home daycare providers, that is a lot, especially in the bigger cities of Pittsburgh, Harrisburg, and Philadelphia, and other areas also, Allentown. There's a lot of different areas that have home-based daycare centers. Every one of those should be tested for radon. We'll get into, well, Nate, that's going to cost money. How am I going to do that? And we'll talk more about that as we get on. Again, the big deal, kids spend time there. They breathe, they run, they play. This is a big deal. Again, now, what I also want to go over, we just went over why this needs to be done in Pennsylvania and is not being done in Pennsylvania. What's going on in the rest of the country? Well, Nate, is there anybody you just went to? Are other states taking this the way we are, or are they doing something about it? Yeah, some of them are doing something about it. One of the things that you may be interested in owning a child care facility is Radon and Child Care Review of State Policies. This was done by the Environmental Law Institute. It's free to download. It's a very valuable and interesting document on the state of care for radon testing in child care centers. Now, this was another advertisement I pulled that was really interesting. Some daycares are required to test for radon, like in New Jersey. We'll get more into that. And some are not. Are your little lungs protected when they're not at home? Okay. So, radon, what you need to know. This is from Pennsylvania. This is from the Pennsylvania Department of Health. Did you know they had this document here? What is radon? Goes through all that. Should I be concerned about radon? Pennsylvania has one of the most serious radon problems in the country. Okay, goes through that. How should I test for radon? What to do if the radon is found? Generally, it's going to cost somewhere around, probably around for a home, $1,500 to about $2,000 on the average cost for radon mitigation. For larger facilities, it will probably be more like 5,000 to say, 5,000, probably $8,000, or maybe more, depending on the size of the facility and the construction and age of the facility. Now, this is just stuff from different states. New Jersey, radon regulations for child care facilities. New Jersey statutes requires that child care centers be tested for radon at least once every 5 years. Otherwise, if they don't test, they don't get their license. So in the state of New Jersey, in order for you to be a daycare center and operate, you have to test every 5 years. Also requires posting of the testing results and many measures taken on the proposed to mitigate, almost like a Carfax. So what we really want to get to is where when parents and when parents and adults are about to put their child or someone into a child care center, they're going to do a Carfax for child care centers. Does this child care center has it been tested for radon? That's going to be my thing. A Carfax for child care centers is that, has this place been tested for radon? If it hasn't, before I put my kid in there, I'm going to really consider, I want the place tested. If it has elevated radon levels, I want it reduced down. Why should I put my kid in a child care center with elevated radon levels that potentially could cause him to get radon related health risks and effects on that? Again, just different areas where this can be done. There's Illinois, there's Wisconsin, there's a lot of other areas that have these rules that are in place. So I'm just saying that because I'm raising the issue for Pennsylvania, other states have done this, and this is a good, say, template to look at, especially if you're approaching your state senators and your state representative for policy and trying to get them to say, hey, we need to have this requirement like these other states have. Okay, this is, I think, is New York, I think, guidelines for radon testing in daycare centers, school-age child care facilities. Okay, so this is the state of New York. Again, caring for our children, even other organizations. This is, a major organization where it talks about facilities, but it also talks about radon as an important thing of prevention and management of toxic substances. Radon is a toxic substance. Why would you want to expose your child to a toxic radioactive pollutant? All right, that's the point here. So caring for our children. Okay, so that's a big deal. Again, Wisconsin, radon in childcare. Same thing. What to do? What do licensed childcare facility care? What what do licensed childcare providers need to know? It goes through that. I'm not going to read all of that, but just to give you a general flavor that other states are actually taking active licensing and policy changes and requiring radon testing in daycare centers. And the question is, why isn't Pennsylvania doing the same thing? That was in Vermont. And then Eco Healthy Child Care. There's a lot of different other institutions that are starting to pay more attention to this. And Women for Healthy Environment did a really interesting and very important study on schools. Okay, so I always assume schools is just one step away from childcare facilities, but they looked at basically the number of schools that really had tested for that. And look at this region here, up at the top, 0% in Allegheny County or Western Pennsylvania. 41% have tested, and then the other ones, basically you're looking at 1 out of 4 schools in Bucks County are in Eastern Pennsylvania have tested for elevated radon levels. That's a problem where we'll test for lead and water, okay, and 89% tested, and there was 91% who tested found hazards. 72% tested for mold. 78% who tested found hazards. And the same thing for tested for water quality contaminants. And then you look at radon, 20% tested. So that's 1 out of 5 schools in Pennsylvania has tested for radon, and 38% who did test it found hazards, okay, for that. Ideally, the testing should be done during the colder months, okay? Again, what does the test kits look like? They're easy to use. They're less than $20. Easy to place. You leave them there for probably I would recommend between 3 to 4 days is the recommendation for a radon test for a child care facility. 3 to 5 days is what we recommend. Recommend placing them. Ideally, there are ways to do that. If you're doing a child care facility, you should hire professionals. I recommend it's not something that you would want to undertake. Hire a Pennsylvania DEP certified radon tester who has experience and training in doing larger facilities. There's actually a national certification for that. It's even mentioned within Pennsylvania DEP. They do mention multifamily buildings and things like that, okay, for that. But schools, ideally, there are standards on how that should be done. All ground floor units in a daycare facility or school should be tested. And if there's a second floor or third floor, 10% of those areas should be tested also. There's a protocol for doing that. If you want more information on that, if you want to do the testing the correct way, please give me a call or the DEP a call. We'll be glad to be of assistance to you. Warning, there's specific things that have to be done. One of the things that's going to be a challenge when doing radon testing, we want all the windows and doors closed 12 hours before the start of the test if the test is going to be less than 3 days. Okay. If it's 3 days, then you want to do closed building conditions. All the windows are closed except for normal ingress and egress. Why? We want to establish a condition that we're not diluting the radon in there. So we get a representative sample, what the actual radon concentration is in the built environment of a daycare center or a school. And these are the protocols that we go by. All right. Just different things here just to show you there's a whole industry behind that anyone doing radon testing or mitigation, say for money as a professional, has to be certified by the Pennsylvania Department of Environmental Protection. All right, that's the thing that I want you to know, both for testing and mitigation. Radon testing, how we're doing with time here. Okay, I'm almost done here. Commercial child care centers went through the same thing. We can skip that. This is what a mitigation system looks like. Well, again, the ideal here is I'm sucking the radon up and pushing it to the outside. The cost is $1,100 to about $1,500. These are just general ideas of what these systems look like. We're just simply sucking the radon up through the pipe before it gets into the living envelope. And lastly, radon mitigation components. This is what it looks like. For some people may have a radon mitigation system in their home. There's like a little manometer on YouTube that shows that the negative pressure is there in the pipe, putting a negative pressure and sucking the radon underneath the slab to the outside. And that's basically how the system works for that. And the other point of this and putting a system like this, when we put in a radon mitigation suction system or a radon active soil depressurization system, not only does it reduce the radon, it reduces the soil moisture impact to the slab. So that basement area will almost, the relative humidity in there will actually drop. So it's sort of like a glorified dehumidifier at the same time. Besides removing radon, it's removing soil moisture, thus reducing conducive conditions for fungal growth and damp building syndrome. These are just more pictures of what the mitigation system looks like. It's not unsightly. They can be designed very quickly by a licensed, certified mitigation company that has experience in daycare centers or residential properties. Just a real quick view. This is actually just more actually a daycare center with an actual mitigation system in. This is one in Wyomissing of a daycare center that I installed the system, and no one even knows that system is installed. We actually installed it in the closet, ran it above the drop ceiling, and that system was successful in reducing the level significantly below 4 picocuries per liter. All right. The last thing is any new child care facility or new school should have radon resistant construction built in. It's a lot cheaper as you build a school or build a daycare center to actually make it radon resistant. It is 10 to 20 times cheaper to do it this way than to wait till after the building is built and then put in a mitigation system. So you would think that any new school, any new daycare center would automatically require a radon resistant design to be put in their school. Again, I do training courses on that specifically for any daycare centers that are planning to build a new daycare center. You should have radon resistant new construction design into that to reduce those radon levels as low as possible as you're building that school. And basically, do you see radon as preventable? That's the key thing here. Radon testing should be part of any health and safety child care program budget for every child care in Pennsylvania. That is the ultimate axiom goal of this whole webinar, is that point. There are several paths for funding this. There is the CARES Act, and I've talked to other state senators. There's money for this. We actually working with several state senators now for producing a bill for mandatory radon testing for schools. And we want to do the same thing for daycare centers. So again, as a house, say for how am I going to pay for that? There can be programs that are set up to assist you in taking care of that. There are things underway as we speak, working with both Women for Healthy Environment and other state representatives and state senators and the Pennsylvania Department of Health Equity Department with Dave Saunders on these different types of things. Again, test your home for radon, test your child care facility, state, federal mandate. Again, this is something you really need to look at. Talk to your legislators, senators, and representatives. Work with Women for Healthy Environment to achieve radon testing and radon reduction in every child care center. And ask, that every child care center, when you put your child in there, what's the radon level? If more parents start doing that, more child care centers will pay attention to that, especially when they're deciding whether they're going to put their child there or not, based upon the healthy built environment of indoor air quality and radon. And I think that's it. Again, it is a call for action. I don't want this to be, well, Nate, that was really interesting. See you later. I really want this to be follow up. Women for Healthy Environment and myself will be available for anything that we can do to assist you. Thank you.
Thank you, Nate. That was great. So we do have a few questions in the chat, just so you know. So I think some of them are answered, but I am going to ask them again just in case some people do
Sure.
have follow-up questions. So Samantha asks, would the bill for mandatory testing in schools include childcare facilities?
No, it will not. So what we will do, we're planning on, and we get this bill, is then to introduce the second bill that really should be easy to do, is to require all licensed childcare facilities to be tested for radon, as in New Jersey and Wisconsin and other areas like that. So yeah, that will be a bill that we will be following up with this year, in fact.
Wonderful. Great to hear. Another question we have from Juanita is, what symptoms will you develop before you know if radon is making you sick?
You won't be able to tell from any major symptoms. It's just like lung cancer. Again, everyone thinks that you get lung cancer, you're automatically getting some sort of itching in your lungs or whatever. You don't. A lot of times, cancer in stage 1 and stage 1A and stage 2, you may not have no idea that you even have a problem unless you get a low dose CT scan or an x ray or see your doctor, your respiratory doctor, or your care doctor for that. So there's no real apparent symptoms that you can tell that you're getting lung cancer. As I said before, that's why, because it's invisible, and it's almost like once you get stage 1A or whatever, a lot of times those symptoms aren't apparent. They simply aren't. Therefore, the focus should be on testing to determine, do you have elevated radon levels in your home, in your house, in your daycare center.
Okay. And to follow up with that, whenever someone develops lung cancer, how fast do they determine that radon is the cause?
There is, again, what you're asking for, is there a smoking gun that says this person has got lung cancer? I can look at his lungs. Yep, he's got lung cancer. He got lung cancer from radon. It's very hard to distinguish between, what the causal factors are. Now, with smoking, there's usually indications of that tar. You've seen enough pictures. If you Google that and see pictures of people taking opening the lungs, you see all the tar inside the lungs and all that. But with radon and different things like that, you're not going to really be able to tell. Where the determination of about anywhere from 13 to 14% of all lung cancers, about 13 to 14% are attributed to radon, from just what we call epidemiology studies and statistics and general stuff like that. To look at, we know the mechanics that definitely radon causes lung cancer, but it's very hard to distinguish that, say, from other types of things that could cause lung cancer. Okay, for that. The other one that does show a clear line is, mesothelioma, and those are lung cancer diseases specifically. That's scarring of the tissue, and they have very clear things that say, yep, you've got mesothelioma, or any of those kind of things that are related to a specific. As for radon, there are no apparent symptoms for that, except that you need to test for radon. And obviously, good medical help. One of the things I'm also pushing for is for women in very high radon levels. You may want to, be looking at low dose CT scans, even if you don't smoke. For that, that's something else I did raise with the Pennsylvania Department of Health Cancer Coalition, is the fact that we may want to consider offering a cheap, economical way to do a low dose CT scan. Again, there are no apparent symptoms, okay, except when you get into really the later stages of lung cancer.
Thank you. And last question that we have is, I just a little more detail on how do you mitigate the radon. So you showed us the systems. Could you tell us like how it works?
Sure, absolutely. So, so here's a radon mitigation system. So what we have here, say when a radon mitigator comes in, he's going to dig a hole in the basement area. So you got a basement, and if it's slab on grade, it would be the slab on grade area. But say it's the basement, I'm going to dig a pit about 12 to 14 inches deep and about 12 to 14 inches wide. I'm gonna, put a pipe in, a PVC pipe, like that white, plumbing pipe. This is a PVC pipe that's generally white. I stick that in, I connect that to a fan. The fan is a radon mitigation fan that creates a suction like a straw when you're sucking liquid out of the glass into your mouth. You're putting suction on the straw that pulls the liquid up. So this fan puts a suction on that pipe that pulls all the radon that's coming up from underneath the slab. It goes there instead of inside the basement, all the way up through. Of course, we're sealing all the cracks and things like that, but that's why we call it a mitigation suction, a radon suction system, because it's sucking the radon from underneath the slab up through this pipe and all the way to the outside that it can be exhausted to the outside. It will spread out and go into the atmosphere. It won't fall down to the ground and you'll be exposed to that. But that's how the mitigation system works. These systems are 99% effective in reducing the levels down to below 4 picocuries per liter. In fact, in Pennsylvania, I think there's easily over, I think close to anywhere from 50 to 80,000 mitigation systems installed in Pennsylvania in residential properties. Most of this is done due to real estate transactions where they have a radon addendum that the buyer has the option to do a radon test. If the test is a 4 picocuries per liter above, the seller generally has to pay for radon mitigation to reduce the radon levels to below 4 picocuries per liter.
Thank you, Nate. Do we have any other questions for Nate while we have him here? Those were great questions. Thank you all for providing those questions. So I'll wait a minute for anyone to type any questions, but while I do that, I just want to thank you, Nate, so much for this enlightening presentation on radon. Your expertise and insights have greatly contributed to our understanding of the importance of radon for sure. And I'd also like anyone here, I'm going to put a survey in the chat box right now. Please take this survey because this is how we will get your PA Keys registry ID so that we can give you the credit for this course. So please make sure that you take this survey. It will also be sent to you in a follow-up email, but please take this. Okay, I don't see any other questions? Do you want to say something, Nate? Sorry.
Yeah, I will say one more thing. Again, for Women for a Healthy Environment and myself, we are available if you have any other questions. Even something may come up later on. I want to do this. You'll bring it back to, say, the powers that be. You want to do radon. If we need to do another webinar, even specifically just for your daycare center, I'll be glad to do that. That's not a problem. The other thing that we would like to do is obviously this is a call for action. So that means that we've got to contact state senators and your state representatives, okay, both federal and state, okay, and getting them involved. I've already started that in Western Pennsylvania. And we're starting that in Eastern Pennsylvania and Philly. So anything that you want to do, we'll be glad to work with you in any shape or form. Just let us know, both Women for a Healthy Environment and myself.
Yes, definitely. Please reach out to us directly. And I thank you all once again for your participation and engagement today. I hope you all have a nice evening.
Thank you.